Welcome back to our podcast, Voice of Care, Caring from the Heart. So I'm your host today, Dr. Jolene, and I have a distinguished guest today here, Dr. Subra, who is one of our experienced orthopedic. So today he would like to share about sports injury. So welcome.
Yeah, thanks. I'm glad to be here.
Hi, so Dr. Subra, what do you do? Are you an active person? Do you normally do sports?
Yeah, I normally play badminton almost twice a week. And of course, it's trainer's activity, but I do certain warm-up sessions before I start. Okay, so yeah, I do a lot of badminton.
Could you share a little bit on your warm-up sessions?
Okay, most importantly, before you start any activity, you need to do some warm-up sessions. Why? Number one, mainly you do light exercises and jogging or walking, and you need to improve your blood circulation to your muscles and joints, improve lubrication, as well to get the muscle more flexible, so that you prevent any injuries when you do any sports.
So it is true that when people say by doing warm-up sessions, it will actually help to reduce injuries?
Yeah, definitely. It is definitely true. We need to do some warm-up sessions. And not only that, after each activity, you need to do a cool-down session as well. This is to maintain your muscle performance in future, to prevent further injuries. So you need to do that as well.
Are there like different types of warming up exercises that we can do?
Yeah, we normally do dynamic exercises for warm-up sessions like squats and arm circling and all that. And we cool down into a static kind of activity, exercises. That is many lunges and to just cool down your body temperature as well. Okay?
Okay, understand, thank you. And in your experience so far, what is the common injuries that you see in your clinic?
Yeah, I think most of the sports injuries are very common is knee injuries, especially ACL tear and meniscus tear.
Yeah, very commonly.
Common and almost a lot of time you see in footballers as well as basketball players. And it comprises almost 55% of all sports injuries. And second in line is ankle injuries, also common, especially in football players. And you can also have hamstring strain as well.
Does all the like the injuries that you mentioned, how is their treatment like? Is it different from one another?
Yes, definitely.
I think PCI is the most common.
Yeah, any injuries, acute injury, they should have something we follow the mnemonics RICE. Any injuries, acute injuries, within 72 hours, we need to put them on. You have to rest the joint, whatever particular joint, and of course, ice is very important to reduce the swelling and pain, and compression. Compression bandage will help to reduce swelling and pain further. Of course, you have to immobilize the joint. All right, and what are things you should not do is there's another mnemonic H.A.R.M, H.A.R.M. Okay, mainly you shouldn't have heat. You don't apply heat therapy on acute injuries. That's number one. And A is stands for alcohol. You can't drink. That will cause further damage.
Yeah.
And re-injury, that means don't go back to sports immediately after a few days. The re-injury is very important to worsen the any ligament injuries. Lastly, massage. You can't do any massage for any acute injuries.
I think this is what people commonly will go their first choice as a public. That's the first thing they will do, especially massage, rather than going to the doctor to get that treatment first. I would say those kind of treatment are all not necessary. Or at least they should get a doctor's advice. Yeah,
they should consult any normal GP or orthopedic surgeon to find out what exactly is the problem.
Alright, understand. Do you have any patient story or a patient that has a very good recovery?
Yeah, I had a few patients 1 or 2 weeks ago with football injury. See, the mechanism injury, whenever they play football, they tend to have, like football or basketball, we have this pivoting type of sudden turn, twisting the knees. That can cause damage. And during the event itself, sometimes they can hear pop sound. That is indication of some major damage to the ligament. Immediately there will be swelling and patient won't be able to continue the sport. So what we do, assess them clinically, whether there is any ligament tear. Certain tests are there for ACL especially. We do the Drawers test and see if there's any sagging sign and Leishman's test. How to confirm the injuries? We normally do a MRI. X-ray also indicated to find out any fractures associated with ligament injury. Later on, we'll do the MRI test. MRI will show exactly about 90-95% of the damage to the knee, especially ACL or meniscus.
Why is MRI preferred management? Is there?
No, MRI is mainly if you are looking at ligament tears and all that. MRI is the best. Soft tissue injuries that will delineate the exact location of the tear and how severe it is the tear. So MRI is the best for any sports injuries.
Okay. Then as for this patient that you mentioned, did this patient has to go to?
Yeah, we did the MRI and confirmed full thickness tear of the ACL and meniscus. So we proceeded with the arthroscopic ACL reconstruction. We do with the hamstring graft. Okay. And also the meniscus we repaired as well.
All right.
So there are certain post-op rehabilitation should be followed.
Yeah.
Of course, initially after the injury, after the surgery, we need to put the patient on a knee brace. That will help to slowly will increase the range of motion. Also, they will refer him to physiotherapy to strengthen the quadricep muscles and to improve range of motion.
But when you mentioned about the knee brace, I suppose it's different from the one that normally we wear.
Oh yes, definitely. The one normally they get it from the pharmacy is just it's a simple one, just pull-on type of knee brace. But this is with the the adjustment of length. I mean the amount of flexion to the knee. So this is for the ACL and PCL as well.
Okay, understood. So how long total it will be for the recovery?
Yes, initially the recovery for the wounds to heal is about 2 weeks, and the physiotherapy should be continued probably once or twice a week, and for at least for a month or 6 weeks. All right. For the particular person who was very active in sports and all that, they need at least 6 months or 9 months to go back to complete. Yes.
Then he can restart again.
He can restart. Correct. They can restart.
What if this person chose not to do surgery? Is there any situation that you encounter where you suggested surgery, however they chose not to do? Will it changes the recovery period?
Yeah, definitely. If the patient is a young patient who refuse any surgery, we will tell them the pros and cons. If you don't do any surgery, I will advise them they can't go back to sports. Probably, especially if ACL is torn.
Totally no.
No, probably they can play some games with the computer games. Sitting. Swimming they can do that, but any weight-bearing sports, especially if, like football and futsal, even pickleball now become famous. It's difficult. It's difficult because the knee will be unstable, so you can't perform to the maximum. Right? And we also tell them if you decide not to play any games, probably you can get away, but we need to wear the knee guard. And that eventually is any unstable knee, especially ligaments, it will tend to lead to future cartilage damage. Okay, if sometimes they will put a knee guard and play badminton, they still go back to sports. They'll damage the cartilage. So eventually he will have osteoarthritis changes within maybe 4 to 5 years. At a young age, yes. We call it post-traumatic osteoarthritis. So that is a drawback if you're not doing any surgery, especially young patients.
So guys, please take note, always seek for your orthopedic consultation before decide for any other treatment. And if an orthopedic surgeon suggested for surgery, definitely it means that you need a surgery. To consider that properly. Thank you for sharing.
Welcome.
And then one last question is that we want to, the audience would like to know, is there any injury prevention tip that you can share with us?
Like I said, number one is we have to warm up and cool down. 2, you have to gradually increase the load. That means, let's say you're playing sports like badminton. Okay, you can't simply go in active sports. I mean, actively play. Gradually, you do some strengthening exercises, build up your muscle. Then slowly you can go back to so don't do it immediately. Whatever, even in jogging or running or marathon runners, you can't do immediately. You have to tone your muscles first. Yes, gradually. So that will prevent further any damage to the muscle. Number 3 is you need to have proper gear, especially if you are running for long distance marathon. You have proper shoes. A lot of shoes are there. And also, if you are playing any sports like what do you call football, sometimes you need to have shin guards to prevent any injury. And also, like badminton, proper rackets and proper way of playing the game. You have to do that. You can't simply go and play.
You don't know that,
Yes,
right?
yes. You don't do proper technique.
Yes.
That will further prone for injury.
Yes, yes. All right. I think that's all for today. Thank you, Dr. Subra, for coming in and joining us.
Yeah, welcome. Thank you.
So before we end this podcast today, you can follow us in Pantai Hospital Ipoh to know more information about our latest updates. And you can follow us on LinkedIn, Facebook, YouTube, Instagram, and also X. All right. Thank you.